Hi, it's Dr. Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma, November 30th, 2020. So November's coming to an end, and we're going to do our COVID update. So we had about 21,000, 22,000 cases in Oklahoma this last week. We had 2,200 cases yesterday. So we are really having this massive surge of cases. There's huge lines for getting tests. I mean, these testing centers can't handle the volume, so figure there's many more positives than that we're even getting reported. The current projections using Dr. Dale Bratzler's data out of the University of Oklahoma Department of Public Health, brilliant guy, can't say enough about him, but again, don't criticize him. He's just a wonderful epidemiologist in public health, please. We're looking at 3,500 hospitalized patients by the end of the month. Again, this is an estimation, well, 3,200 to 3,500. I don't want to misquote him. There's a range there. And that makes sense based on what we're seeing at a hospital level with about 1,500 patients in the hospital right now and the case numbers going up. So everyone needs to get prepared for what's ahead. There's going to be innumerable infections, innumerable people you know are going to get it. A small proportion, well, not tiny, are going to get fairly symptomatic, and a small proportion overall, probably about 10% classically, are going to end up needing hospitalization. We've had several patients who got rather sick in the last week, and so it really does happen even when you're doing the right things. And so I just can't emphasize enough, do the right things. So let's list them out. 1, take all your vitamins. The zinc, 50 milligrams to 30 to 50 milligrams a day for a month or two, and then you go to every other day. The vitamin D, 5,000 units every day. Your fish oil every day, because again, the blood clotting event and the pulmonary embolism event is devastating, and that's happening as the frequency of disease events is going up. So is that the incidence of that happening and hitting our hospitals. Vitamin C is an option, but if you get COVID immediately, crank it up to 4 grams a day. Melatonin, 1 to 2 milligrams for maintenance, and a multivitamin. You need to do that stuff. I can't emphasize it enough. You want your immune system tuned up. If you get very sick, there's going to be a shortage of hospital beds. A large group of us have been working very diligently on this with the local hospitals, the state health department, etc. But I think at this point, I believe very firmly we're going to be overwhelmed, and you have to maximize your chance of not getting super sick. Likewise, at-risk behaviors. This would be the time to skip the unnecessary ATV ride and things like that. Again, you don't want to be going to the hospital where all the COVID patients are, and you don't want to have injuries or things that may not be able to be fixed in the near future or for months on end if this goes the way, unfortunately, we're expecting it. And I know I'm being a little doom and gloomy tonight, but I think we need to understand what we're headed for. I wish I had better news. We've been working incessantly. The group that I coordinate, a big shout out to all the chief medical officers and administrators who've been in it and are continuing to work. But I think we're all feeling a little bit overwhelmed that no matter what we're doing, it's not going to be enough. And the reason it's not going to be enough is because we need people to stay home, we need people to wear masks, and we need people to wash their hands. And so Oklahoma, unfortunately, is an epicenter of the virus. So going out in Oklahoma, and it turns out it looks like stores, big box stores, maybe account for 55% of cases. There was a report about that. But it clearly, fluid dynamics with viral particles in the winter change. So going places where there's people is probably not a good plan. So I would encourage all of you to avoid going places where there are people other than your own homes, or if you have to work, which we all do. So that's really the focus tonight. You need to stay home. You need to follow good hygiene. You need to wear your mask. I don't know what else to tell you for those of you who still think masks are incorrect. See what happens, unfortunately. I mean, there's lots of reports now of people, the last thing they're saying before they're getting intubated is, think this is a hoax. I'm not that sick, and da 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 da. And, there was a report of that, a case report or from a doctor on that he's seen from taking care of people. And it's just kind of disturbing that the denial is so great. So, anyway, don't deny it. People here in Oklahoma City are dying of COVID. People I know have died. And so we really need to batten down the hatches because I don't want anyone else I know to die of COVID. And unfortunately, I think I'm going to know people who die of COVID that are going to get it. And I don't want it to be you. So thank you and good night.